breast lift, breast reduction, no implants. I knew that I did not want to get breast implants this time either, and I'm going to tell you why. Hey squad, I'm back from my YouTube spring break. No worries, I'm not going anywhere, okay? This week I'm going to talk to you about why I decided to get a breast lift and breast reduction without implants, even after a failed breast fat transfer back in 2016. So if you're new here, hello, I'm Jessica Yum. I help women reach their body, beauty, and business goals through my brand Body Yum and by linking them with other industry leading businesses and resources. I'm so excited to have you all here with me today and to discuss the different risks and complications associated with breast implants. Are some complications and adverse outcomes when it comes to breast implants, and although these are possible, keyword here possible and not promise, is just not a risk that I wanted to take. Let's talk about some of the possible risks and adverse side effects of breast implants. There's asymmetry, where the breasts are uneven in shape and or size, or even breast level. There's breast pain in the nipple or breast area. You could have thinning or shrinking of the breast tissue. There's a risk of calcium deposits, also known as calcification, and there are hard lumps under the skin around the implant. If you were to get a mammogram and you have these hard lumps, sometimes it can be mistaken as breast cancer. And actually, I had some of this after my breast fat transfer. So I have to have my breast checked annually just to make sure that there's nothing serious going on. You could have a chest wall deformity, where your chest wall or your underlying rib cage appears deformed, which is often due to a rupture. And a rupture is a cut in the implant shell, and that deflation could cause a partial or complete collapse of the implant. You could simply have just delayed wound healing, where the incision site fails to heal properly or just takes a very long time to heal. You could have extrusion, where the skin actually breaks down and then the implant is seen through the skin. You could develop a hematoma. A hematoma is a collection of blood near the surgical site, which could cause swelling, bruising, pain. A hematoma would usually occur shortly after surgery, but it can occur at any time that there's an injury to the breast. Now, your body may absorb small hematomas, but larger ones would require you be seen by a medical professional because you'll probably need surgical draining. You could have injury or damage to the tissue or the implant as a result of the surgery. We know this is a risk of any surgery, but of course you could develop an infection. And if you were to, say, develop a bad infection, you may actually have to have the implant removed. You could have inflammation and or irritation, where there's swelling, warmth and or pain and or loss of function. You could develop lymphedema. Lymphedema is swollen or enlarged lymph node. There could be a malposition or displacement where the implant simply is just not in the right place. And this can happen during surgery or even afterwards if the implant shifts. And shifting can be caused by various factors, including gravity, capsular contracture, or trauma. You could get necrosis, which is dead skin or tissue around the breast. Necrosis can be caused by an infection, use of steroids in the surgical breast pocket, smoking, chemotherapy, radiation, and excessive heat or cold therapy. You could have nipple or breast sensation changes, like with any breast augmentation. Of course, there could be redness or bruising, which is pretty normal after surgery. But just mentioning that, you could appear very red and or swollen. I mentioned it before, but there could be a rupture, a tear or a hole in the implant's outer shell. You could develop a seroma, a collection of fluid around the implant. And the body may absorb small seromas, but large seroma would have to be drained. You get a skin rash on or around the breast. You obviously could just be unsatisfied with the surgery, you know, with the size, the placement, or the look of the implant that was used. Be visibility issues, for instance, the implant being seen through the skin. There's also wrinkling or rippling. There could be wrinkling of the implant that could be seen and or felt through the skin. Okay, so that list of local complications and adverse outcomes occurs in at least 1% of breast implant patients at any given time. Breast implants are not considered lifetime devices. The longer you have them, the greater your chances of developing some sort of complications. Those complications may require additional surgery. Types of surgical procedures that may be performed in a reoperation include the life of breast implants varies by person and cannot be predicted. You may have to have your implants removed at some point over your lifetime due to one or more complications. And there's two types of removal. One where just the implant alone is removed, and the other where the scar tissue that surrounds the implant, also known as the scar capsule, is also removed. And if you're watching this video because you are considering removal, you should talk to your plastic surgeon about which removal method is best for you. Some women decide to replace the implants after removal, and some women decide not to replace the implants. Some unfortunately may like to replace the implants, but due to some sort of medical condition or some complication that had occurred, they're unable to do so. And of course, the women who decide not to replace the implants have other things to think about. Those who do not replace their breast implants may have cosmetically undesirable dimpling, chest wall concavity, puckering, or sagging of their natural breasts. Women with larger breast implants, especially with those that were put on top of the muscles, may have major cosmetic deformity if they decide not to replace the implants. And FYI, some insurance companies are not recovering implant removal and or replacement, even if there are complications and even if the first set of breast implants was covered. I don't know about you, where you are on your surgical journey, but I've already had 5 different procedures, 4 of which were pretty invasive procedures, all of which invasive, but 4 of which were major surgeries. So I'm not looking to be thinking about replacing and or just removing my implants down the line. Capsular contracture, another complication. I'm sure you've heard of it, but do you know what it means? Let me tell you. Capsular contracture is the hardening of the breast around the breast implant. It can occur in the tissue surrounding one or both of the breast implants, and this hardening causes the tissue to tighten, which can be very, very painful. Capsular contracture may be more common following infection, hematoma, or a seroma. However, the actual cause of capsular contracture is not known. There are 4 grades of capsular contracture known as Baker grades. Grades 3 and 4 are considered severe and require reoperation. I mentioned both rupture and deflation earlier in this video. Again, a rupture is a tear or a hole in the breast implant's outer shell. And here's a list of different things that may cause a breast implant rupture. The term rupture is used for all forms of breast implants, but the term deflation is only used for saline-filled breast implants. If your saline implant ruptures, then the saline solution that fills the implants will leak either immediately or over the course of several days, and then your implant will become deflated. You'll notice that your implant loses its original size and or shape. If your silicone gel filled implants were to rupture, you may not notice right away because it's more of a silent rupture. No, it's not filled with this fluid that may be linking all over your body, but in time you may notice, change in the size or the shape. You may see or feel hard lumps over the implant or the chest area. There may be an uneven look of the breast. There may be pain and or tenderness, tingling, swelling, numbness, loss of sensation. These are a little bit harder to indicate. Generally, when silicone gel implants rupture, the silicone gel will escape through a tear or a hole in the implant shell, but it remains confined with the scar tissue that's around the implant, if that makes sense. That's actually called an intracapsular rupture. And if the gel migrates beyond the scar tissue, then that's what's known as an extracapsular rupture. Sometimes when the gel makes it out that way, it could start to migrate and move to even other areas in the body. It may be very difficult to remove silicone after a rupture. Silicone breast implants can actually rupture at any time after your surgery, but the longer the implant is in its place, the greater the possibility that an implant may rupture. Some women who undergo breast augmentations can still breastfeed and some cannot. There's no way of really knowing, but women who have breast implant reconstruction surgeries may not be able to breastfeed on the affected side due to the loss of breast tissue and the glands that produce milk. Have you heard of breast implant illness? So breast implant illness is actually a term that some people and doctors use to refer to a cluster of systemic symptoms. These symptoms can develop after undergoing reconstruction or breast augmentation that includes breast implants. Breast implant illness can occur with all types of implants. So it's not just textured implants. It's textured, silicone, saline, smooth, round, or teardrop. Doesn't matter, okay? People are experiencing various symptoms. Breast implant illness affects different individuals in various ways. Let me go ahead and show you a list of some of the possible symptoms. Some develop symptoms immediately, some develop symptoms years later. These symptoms can mimic autoimmune and connective tissue diseases, such as lupus and rheumatoid arthritis. And some people with breast implant illness also get diagnosed with a specific autoimmune or connective tissue disorder, but many do not. In many, but not all cases, removal of the implants does help to alleviate the breast implant illness symptoms. Breast implant illness is not officially recognized as a medical diagnosis. There's no medical code for it. Not enough research has been done on this unique condition. But again, it's a cluster of symptoms that does not fit into any other medical diagnosis. There have been a couple of small studies performed on women who have self-reported breast implant illness symptoms, and upon removal of the breast implants, they did find that many patients who experience breast implant illness symptoms do notice improvement once the breast implants are removed. Some of you really love the look of breast implants, and that's what you're going to go ahead and do. You're going to go ahead and get your breast implant surgery, which is totally fine. I 100% support you. More than half of the women in my surgery group have breast implants, and I support each and every one of them and each and every one of you wholeheartedly. I just wanted to share some of the risk and complications of breast implants and tell you why I personally have chosen to get a breast fat transfer and then go ahead and get a breast lift and small reduction without implants. My boobs are pretty much the same size, just fuller and lifted and better shape.